my pleasure today to introduce two of my esteemed colleagues who are both left-handed advocates. So when I went into medicine, I knew I would face challenges for being a woman. I know that most of our prejudice that we have are based off of silly things when you get down to it, but never did I expect prejudice for being a lefty. I remember my greatest fear as a med student was being asked to cut suture because I looked like an idiot since all of our instruments made for right-handed people. So Julian, when I got to, sorry, I'm out of breath. when I got here, Dr. Wan encouraged me to create a society for left-handed surgeons to advocate for getting surgical training and instruments specific to lefties. And I never got around to it, but Dr. Sack did. So I'm really excited to hear from them today.
All right. Thank you very much. We're going to take this opportunity to share you some of the research that some wonderful people have done. We have Tim in our audience here. He's actually the resident who helped write a paper and recently was in Medscape. For those of you who are on it, you should definitely look at that. That's an interesting independent observation of our findings. So we're going to get started here. And we have no financial disclosures to speak of here. Now, there are many notable people on this list. Yuri Carey, Helen Keller, Lewis Carroll, Matt Graney, Neil Armstrong, Ro Wang, most who don't remember here, but faculty, though, excellent resident, Courtney, John Dillinger, Jack the Ripper, and of course, Bryan Sack. And all of these people are reportedly left-handed. Now, left-handers represent approximately 90% of the population. They're right-hand dominant. The left-handers are 10%. They're left-hand dominant. A very small percentage are truly ambidextrous. There's actually specific testing of that. So those people who claim to be ambidextrous mostly are not. They're usually left-handers who have adapted well. Some people show mixed handedness. That say they are very skillful in certain things for certain tasks. But when it comes to very fine motor actions, which would include calligraphy and sort of fine surgery, most people are dominant one side. Interestingly, animals are actually split 50-50. There's a rumor, a myth on the internet that polar bears are left-handed. Actually, it's not. They are actually mixed. The studies are based on the fact that when you actually ask animals who have a paw or foreleg to actually reach into something, they'll divide themselves almost perfectly 50-50. Other creatures do show dominance on one side, but that's due to body habitus and anatomy. So, for example, fiddler crabs, certain subgenuses are left-hand dominant because they're claws, the big one, and some are right-hand. And occasionally they have variations where it's the correct species, but they have flipped over on the other side. But again, that has not been shown out to be a consistent finding. Historically, our basis of understanding left-handedness goes way back. Unfortunately, the sort of Paleolithic, Neolithic evidence is sparse. They have cave paintings, they have illustrations of the past. And unfortunately, for our modern scientists, a lot of this evidence is relatively weak. So you can have depictions of things that look like they're left-handed, or you have depictions of what looks like to be a left-handed person using a predominant left-hand tool. There's also people who will use evidence like flint tools, other things that they surmise seem to be more oriented for one-handed or another. But working from this, this is actually a big area of social science research. If you believe that the hominids originally came from sort of our background, then it's about 50-50 split. Studies of modern primates, great apes, find that it's very similar to that. But then down here, the evidence gets a little sketchy because you're based on sort of interpretations of things that we find. Things like, for example, skeletons. The right hand is usually denser on skeletal analysis than the left hand if you're right hand dominant. And then look at tools again to say, well, this flint tool looks like it should be more right hand oriented. Or people look at bite marks and seeing which side is grinding on teeth and so forth. You can see it's hugely subject to interpretation bias, survivor bias, all sorts of different types of biases. Over time, though, when we move into our more interesting era where there's actually some history, sort of a literate area where we have surviving art, artifacts, tools, and most important, literacy, people actually denoting themselves as being left-handed. It seems to sort of tail off and reach about 10%. And as we move into the more modern era, where now people are literacy, there's formal education and training, it remains pretty steady. But then there's an interesting dip that occurs between 1800 and sort of a post-war era. And that's, I think, worth understanding and realizing as educators, because this is also a period of great educational reform. Education became more of a standardized things, 3 R's, reading, writing, arithmetic. And it's also an era of great social engineering efforts. You have eugenics rising here, you have efforts to formalize education. It's also an era where you began to see the rise of what we would call real science. Previously, genetics was the sort of observation of, Mendel and his P's, but then later on, it became the era where you actually have molecular genetics. And from that, we know that there's a certain background degree of left-handedness. So if both the mother and father are right-handed, there's about a 10% chance that the child is left-handed. If the father is left-handed, but the mother is not, it's only pretty close to that still same background, 10 to 12%. But the mother is left-handed, it's a greater effect. It's about 20% likelihood. And if they're both left-handed, it's as high as 30, 40%. There's a slight male predominance among left-handers, 5 to 4. Now, I mentioned that dip era. This is where you actually have what we would consider more of a modern science and rigor and research. And Gilbert and Wysocki look at hand preference and age in the United States, found numerous studies, surveys, and secondary evidence where people are looking at something else, but they had noted handedness, and surveys of which side people favor and other things. And they find this dip occurring between the 1800s, and it seems to pick up after World War II. This was actually replicated, again, another science development that we don't take things on pure observational. In fact, we don't take people's word on. People try to reproduce that. And McManus and others, going through a different approach, found that same sort of dip present. I emphasize this to tell you that things can be changed or altered, or things that we don't think of, think as innate, you're born that way, can be subject to efforts that people try to change things. So the question is this due to reporting error, reporting variance, reporting bias, or actually was there a rate of handedness changes? Some people have argued this is related to some medical disadvantage, or was it an effort to suppress reporting? It's been noted worldwide, even today, that countries that rate highly on sort of compliance or political suppression report the lowest left-handed rates. They're down to 1 to 2%, whereas the rest of the so-called democratic world is like 10 to 12%. Take from that what you want. Now, thinking back to your neuroanatomy, remember that the brain is cross-wired. So your right hemisphere primary jobs control the left side, the left hemisphere controls the right side, and they sort of parse out all the different little functions like spatial visualization, language, math calculations. This led to some people to argue that part of the effect of left-handedness is that there could be some type of genetic central nervous effect. So they know that there's a genetic association with it, or events. People have had significant prenatal events, prenatal screening, prenatal exposure to diethylstilbestrol. Strangely enough, tremendous numbers of high-intensity early ultrasounds, and then other association like low birth rate, breech presentation, autism. And among cerebral palsy patients, studies have shown that a very high percentage, up to 40%, are left-handed. And the impact of this, that are people who are left-handed more prone to accidents, are they more prone to ill health? And people have actually suggested that being left-handed makes you a greater risk if you're driving because of that. So this led to sort of a pathological concept that there is a background basis of right and left-handedness, whatever that is. As you can see, it's there. But then if something were to happen early on, some pathological event, and then knocks out part of your CNS and you're adapting, there's a certain amount of neuroplasticity, that explains a certain amount of association between people who are left-handed and having other events, simply because you're starting out with a right-hand group that has greater numbers, so they were hit equally by this whatever pathological event. If they switch over the sides, that would explain that finding. This is subject to huge dispute. Some people really believe this, other people do not. Now, giving you this quick background about where things stand, what about the social perception impact? In general, it's rarely been positively left-handed. Among the groups that have been noted, Incas believe that there were some spiritual benefits to being left-handed. In fact, one of their monarchs, the Sapa Inca, Loke Upaki, was viewed as the glorified or glorious left-hander. His rule, and he was left-handed. But in general, it's been mostly negative. Partly is religious, partly is social ethnic. Many places around the world, since the right hand is your dominant hand, they will use it for things like eating and interaction and cleaning and so forth. And because the left hand is non-dominant, we use it for personal cleansing, such as wiping and so forth. In fact, it's so ingrained that it's considered rude if you were to extend your left hand or use your left hand. And this has been worked into literature. So it's the right hand of God, it's the right hand seat of honor, whereas the left hand has fallen out of favor. It's associated with Satan, evil, the devil. And it's quoted in the scripture that the shepherd set the sheep on his right, the goats on his left. So goat doesn't have the same meaning it has today, but there you have it. So Bryan is one of the goats. Now, I point this out that the language is important. Now, David Bloom would be happy to see this. Edward Sapir and Benjamin Whorf, there's a very interesting hypothesis. It seems obvious to us that how we think about things will affect the language we choose. So example, if we're really into sports, we view things through the sports lens, we use a lot of sports analogies. But they flipped it around to say, no, what about your language itself alters your perception of reality? So this is important for educational standpoint. Like if you're exposed to certain language, that would actually alter your approach, especially if you're naive to that subject itself. It'll literally alter your physical construction of your ideas in your mind. And that in turn will therefore alter the way you act in the world. So in a sense, language actually alters reality. Important thing to keep in mind. And so you have language bias. Left itself, according to the Oxford English Dictionary, derives from the Old Anglo-Saxon left, which is not a car ride, but actually defines weakness. Sinister is the Latin adjective for left, associated with evil or bad luck. Contrast, dexter, the right side, is associated with skill. That's where we get the term dexterity. And it's subsequently all the root languages. So gauche, those of you who have heard about the Rive Gauche, that's the left bank in Paris on the Seine. It's also used in English for clumsy and maladroit. Links, left in German, is clumsy, underhanded, or dubious, or dodgy. And then there's a wonderful English use, left-handed compliment. That's the veiled insult. One of the best examples comes from John le Carre's Smiley's People, where Carla, the code name for the director of the 13th director at the Moscow Central, a very dangerous spy master, is trying to recruit this economist, Anton Grigoriev, and basically pressure him to be a go-between. He says to him, I understand in matters of routine you accept. A beautiful left-handed compliment. It's very subtly done. In fact, it slides by you until you realize what he's really doing, and he wants to find out how smart or dim or how scared this guy really is. Now, language, therefore, can affect society and civilization, and we see a social bias from this language bias. Historically, many cultures and countries have tried to force children to write with their right hand. Curiously, among East Asia, where technically the calligraphy is from right to left and vertically oriented, this still exists, but that also partly for social reasons, because if you use chopstick, if you have a right-handed dominance, you have the left person be smashing into each other. Papers as early as late as 2007 noted that almost 60% of people are left-handed report as actual efforts, educational efforts, or to try to retrain them as being right-handed. So this is not exactly faded away in the past, but it can. We do know that from other studies, this from Europe, that people of the older generation were more subject to this. So people reporting 65, 74 years old only had a left-handed survey of 6.2%, which much younger people, 35 to 44, 44, 44, show the rate similar to what was expected in the background. Many people have interpreted that means things are changing. People are able to feel more comfortable identifying as left-handed. People feel more comfortable and they're not being forced to train. Other people has argued that this is survivorship bias, that whatever's happening in left-handedness means that they're not surviving to be old enough to report upon this. And that brings us to the practical effects. Most tools in the workplace and environment are designed for right-handed, 90% of the population. Certain things like trivial, like playing cards, for example, it's actually designed to hold your left hand so you can see the playing cards and fan out. It's not sort of universal. You notice that this is a nearly universal design. Certain other things that we think of as left-handed, like musical instruments, you hear about left-handed guitars and so forth. But curiously, most instruments, people who are very good musicians have required sort of both hands to actually play the instrument. Trombones, people who are violinists, for example, they may be right-hand dominant with their bow, but their left hand does actually a lot of the work. So they actually rate very high in their capability to use both hands. In sports, we see that left-handedness is a critical factor in sports where it's player versus player. In other words, one player is playing another player, like fencing, tennis, or some other situation where the laterality is critical because of a one-on-one confrontation. And the argument has always been that if you are only 10% of the population, you're used to seeing right-handers as a left-handed. So you're very capable of sort of understanding how you encounter those sort of players. Whereas the right-handed players don't counter many left-handers, so they're a little disadvantaged. That's why in the Olympic fencers, half of them are left-handed. Among ATP top 100, top 50 tennis players, 40% are left-handed. And in baseball and cricket, nearly half of most teams are left-handed. And that's because they have this one critical event, the bowler versus the batter, the pitcher versus the batter, some point when it's actually makes a difference whether things come from the left or right-hand side. In larger team sports like American football, you have certain peculiarities, like we hear about the blind side, the left tackle. That's because most quarterbacks are right-handed, supposedly you have to protect that side. But in other sports, such as player versus course, player versus time, golf, swimming, athletics, it doesn't seem to be as critical because you're not actually taking advantage of your left-handedness against your opponent. Now, it's interesting that where there is acceptance of left-handed sport, the economic effect of it is minimized. Baseball, for example, is a very early adopter. They realized that you have left-handed pitchers, left-handed hitters is very useful. So even back in the era where gloves had to be handmade, and they still are sort of hand-stitched together, but they have machines to help them, it's trivial. You can get a glove that is a right-hand glove for a person that throws left, or a left-hand glove for a person throws right. Not been a problem. For less popular sports like golf, it was a difficult thing in the past where someone had to physically create a second set of molds and so forth. But as certain sports became popular, development of CAD/CAM technology made manufacturing easier. It became trivial. So now getting a left-hand set of golf clubs is a minor matter. You just order it. They just make it. And in other sports, the acceptance of it has gotten to the point where, due to the advantage of the sport, people want to see people use their left hand. So among hockey, for example, there are people who are right-hand dominant because they play left wing or because of the way they coach, they learn to shoot with their left side dominant hand because for tactical reasons, it's very useful to have that type of player out there on the ice. Certain sports, however, ban right-handed players due for very practical safety reasons. This is highlight, and then highlight is placed on this sort of unique three-walled venue. And because the right-hand wall is open to the audience, you can't have someone with left hand curling this giant ball at them, because otherwise they'll come out of the field of play. And another exception is polo. This is real polo played on a horse, not water polo. And the Hurlingham Polo Club, that is like the Royal and Ancient Golf Club, St. Andrews, managed the rules have essentially prohibited left-handed play due for safety reasons. So there are numerous people who are left-handed, repeatedly. Prince Charles, now King Charles, is left-handed. He loves playing polo, but he can't play left-handed because of these rules, because the fear is that the two sides will then clash each other, increase the number of risks of injury. Now, interestingly, there are people who are truly ambidextrous, and this is the only example I find in sports. Ronnie O'Sullivan is arguably the greatest snooker player ever. He can easily play with both the right and left hand at the world level, championship level. And in fact, when he first started doing this, sometimes he'll alternate shots. His opponent thought he was being insulted in protest. But then people realized, no, he can play at a world championship level. That'd be like someone tennis player decided to play some sets with his left hand, some sets with his right hand. And if you've seen him play, you realize he's amazingly good player with his left hand, even though he's primarily a right-handed player. Among tools, we know that it's been geared towards right-hand dominance because the design favors the biggest population. So scissors, can openers, and subtle things like design of cameras. It's used to being designed with the right hand gripping it. Your thumb controls it. Your left hand's supposed to fiddle with the lenses. And certain ergonomic things you don't think about. Like just look at the design of that coffee maker. It's really designed for a right-hander to put that thing in and the pot to be on the left hand. And certain types of knives, especially Japanese knives, have an angled pitch to it. It's actually favored right hand. Now, when it comes to practical tools, there's an actual safety danger. This is a bandsaw and it's set up, and the safety manual assumes you're right-handed, therefore come a certain way, and all the safety features are designed that way. Other features like circular saw, this meat slicer are designed for right-hand use. So if you imagine if you're left-hand dominant, very strongly left-hand dominant, this will be a little trickier for you to use because it actually will force you to put your body against, or your hand much closer to the sort of dangerous cutting element, as opposed to the way it's designed to prevent it for a right hand. Interestingly, as technology has improved, we now have a mirror image type cockpit. This is from the Airbus 320. This is one of the early fly-by-wire aircraft. And they've eliminated the joystick or yoke. Instead, they have hand controllers. Because the central column is mirrored for both the left-hand pilot side and the right-hand co-pilot side. Right-handed pilots who using sit in the quote left-hand seat or the command seat had to learn how to use their left hand, and most of it adapted very well. There hasn't been any accidents reported due to this sort of confusion and handedness. That may be simply because of the nature of the control. Or you can just flip it around. You can certainly fly the airplane from the other side and use your right hand on this. But it shows that with technology, with advancements, manufacturing, there's no reason why there has to be a certain design favoring one form or another. So how does this influence us? We got interested in this because we were wondering how this will have all impact on training, recruitment, and interest in developing urology. At the recent celebration of the University of Michigan football team winning the national championship, it was noted that the American Football Coaches Association gave the U of M their award for winning the prize. And Jim Harbaugh made the note that there was 14,000 high school, college, and professional coaches. That's actually more than the number of working urologists in the United States. And I would argue there's probably in any given county more likely to have a football coach than you have a urologist. You know from the census that half the counties in the United States do not have a urologist. And I dare say more than half the counties in the United States do have a football coach. So what can we do to lower the barriers? Does being left-handed make it hard to learn surgery? Does it discourage people from going surgery or procedural career? And does it lead to some type of ergonomically destructive behavior? Like if you're left-handed, you're trying to use a right-handed needle driver. If you've never seen someone struggle with that, it's a really terrible thing. It makes you cringe what they do with their thumb. And is that leading us to miss out on urologists? Are we missing people who would be very good at being a urologist because of these barriers? So they go to high school, university, they do well in their MCAS, they get into medical school, they do well here, the USMLE, and then their left-handedness is not accepted or discouraged, or people are very mean to them, so they end up in a non-surgical, non-procedural specialty. They get to residency, they want to do fellowship, they meet hostility there, so maybe they never make it to the type of thing they really want to do. We end with this idea that, Bryan has asked me, well, what do you think about the training part when you have two people, you're trying to train someone, faculty is trying to train someone who's left-handed. What about two people activity? Well, dancing is one of the most famous ones where it's choreographed. So you have to sort of think about ahead of time, how are you going to work together? There's certainly tools adapted and procedures that have like two-man saw. And certainly people play doubles. And so classically the double setups to have both forehands cover the middle, but again, that's individual taste and preference. And finally, technology is now advanced to the point CAD/CAM's now made easy to get instruments. So the idea of left-handed instruments being prohibitively expensive is simply not true. I bought the first set of left-handed instruments for use and are not, and they're essentially the same cost or little difference than the standard ones. So literally, they just hit a button, flip over to CAD/CAM design, they have it. Now, some people have asked us, well, isn't this an ergonomic issue? We get ergonomic awareness, and people send us things about making sure we sit up, make sure we adjust our monitors, make sure we take breaks and so forth. So here's a tool we're using all the time, repetitively, working with our patients, hours at a time. So why isn't that not an ergonomic issue? Well, we've tried to talk to them about that. We actually went and talked to them, asked for a grant. They were asking us solving something. And we thought this will be a perfect ergonomic issue. It's a simple grant, it's cheap to get the instrument. They didn't want to hear about it. They said, this is not really our thing. This is not it. So they turned a complete blind eye to it, buried their head in the sand. They really did not want to deal with this. Even though if you think about it, I honestly think this is what can be like, just need one good lawsuit, OSHA ergonomic thing, because arthritis and the joints is a real thing. So I will now turn it over to, with this background, to Bryan Sack, who will talk more about this.
Thank you, Julian. This project has been so much fun. I mean, it brings so much joy just to talk about this because it gets so many people excited, whether or not they're right-handed or left-handed, education, not education. As Julian had talked about, the Medscape article comments was just the article was just published a couple of days ago, and there was like 25 comments on there just from all over the map. And I'm going to show a few of them in a second, but where I'd like to start is just a simple question of, you're left-handed. I mean, I get asked this question all the time in operating when I'm sewing with my left hand. And I mean, the answer to the question is obvious. Of course I'm left-handed. Why are you asking the question? I'm not right-handed choosing to sew with my left hand, or same thing when I'm holding a pencil or a fork in my left hand. And so I like deeply think about this question. I say to myself, well, are they asking themselves, like, is it just a surprise question? Is that really a question, right? Or are they asking themselves, like, you're left-handed, how do I have to change what I do, right? If you're a scrub tech and you're saying you're left-handed, if you're a faculty member working with a medical student saying, oh, you're left-handed, how does that, is that like asking themselves, like, well, do I have to do something different here? And so that's kind of like the questions I want to ask you, like, what do you do to accommodate the left-handed trainee? Do you ask them outside of the table? Do you ask them about, should scissors be in the right hand and forceps be in the left hand, or do you switch them for them on the robotic console? Do you ask them about approach, things like that? Maybe you don't do anything, right? Here's one of the comments I was talking about from the Medscape thing. So here's somebody who does orchidopexy, what I thought was kind of funny and appropriate. The first comment I read is, oh, come on, if you're left-handed, you know how to cope in a right-handed world. There's probably some truth to that. Been accommodating for quite some time. A knife has no handedness. We right-handed surgeons have to cut down on our index finger with a knife in the left hand when we're doing an orchidopexy. So already you can see people feel very strongly about this, one side or the other. And then I asked the next question, well, what does the left-handed trainee do to accommodate you, the right-handed surgical educator, or even the left-handed surgical educator? I think people who are left-handed, they probably don't realize how much they accommodate for the right-handed world. But if I were to show a picture of this to a left-handed person, I think I know what they would see. Walking to a table at a restaurant with a group of 4 people, what they see as you're walking and heading to the table is this. There are 2 seats at that table that they can sit at that will prevent them from bumping elbows with you, a right-handed person, to eat at the table. It's unconscious at this point as you approach the table. And I think a lot of left-handed people make these accommodations unconsciously, and they accept that this is part of their life. But this whole becoming a surgeon thing and learning a new technical skill is where I think that they could be helped through that process a little bit easier. So that's where the whole kind of research comes in. I just want to just give a shout out to a handful of different people. Obviously, Julian came up with this idea early on and has helped coach this through entirely. But I want to thank Maya Anderson. She's a general surgery resident. She took her research time during her general surgery residency to kind of create and work together with myself and Mary Burns to create some really powerful qualitative studies. Tim Gilbert, who's here in the audience, is a general surgeon intern now with a medical student. When he started working with us, kind of helped write some papers on this and help move a lot of this forward and get this out into the open. And then Dana Feldman, a medical student who I've been working with and mentoring as a left-handed person, and she's been kind of helping work with the medical school to kind of create like new ways of helping left-handed medical students and trainees. So it all started early on with a very simple survey that we sent out to the medical student body. And all we asked was like, are you going into surgery or not surgery? And are you left or right-handed? And there's a very small difference, with left being the blue bars and red being the red bars, but about a 5% difference between the two groups. We didn't power this to answer that question. We would have needed 3,000 responses. But if that is true, that might be significant, a 5% difference, right? So we asked another question, is like, did your handedness affect your surgical rotation experience? Again, very simple question divided into handedness. And in short, those that were left-handed had a 90-time more likelihood of reporting that their handedness affected their surgical rotation experience. Maybe that just meant they had to think about it. Maybe it meant that they actually had to make adjustments. Maybe they were forced to use their right hand. Again, we didn't dive into that exactly, but we'll talk more about that in the qualitative studies. And then lastly, did this make you question or change your residency choice? And there was about 13 times the odds of questioning or changing their careers due to handedness concerns. So this kind of just made us ask the question of like, well, why is this? What's like the deep, what's going on exactly? And that's where the whole qualitative analysis and assessment of surgical trainees across the country comes in. And as I had mentioned, Maya Anderson kind of spearheaded this, and without her, this wouldn't have been possible. But what we did was we surveyed people who identify as left-handed or surgical trainees from across the country at 15 programs across the country. And we did semi-structured interviews of these residents and fellows. There were 31 people we interviewed. They kind of spanned the surgical specialties, with most of them being from general surgery. Most of them are senior residents. Most of them are operative hand dominance is left. However, you can see, even though they identify as a left-handed person, they also have a high likelihood of operating as a primary right-handed person. So we then took all the information, we kind of separated into the medical school experiences and then the surgical experiences during training. And I think there are kind of two different things. I think medical students are kind of figuring out where they want to go in career. And then in residency, you're actually figuring out how to become that person in that career. And that comes with more of the technical training and understanding of surgery. So from the medical school experiences, they kind of broke it down into three themes. So first, disorienting advice from faculty or residents. 2, discouraging right-handed pressures and left-handed stigmatization. And 3, educational wishes of left-handed medical students. So I'm going to read through some different, quotes from these trainees to kind of, I think they're a little bit more powerful to help you understand exactly what they were feeling. So disorienting advice from faculty or residents. I feel like I've gotten a lot of different information too, right? Like initially in med school, I was told, well, learn everything with your right hand because no one likes a left-handed person. And then I was told, no, if your left hand is your dominant hand, you should bovie with your left hand. You may be able to sew or do other things with your right hand, but you should always be using your dominant hand like for fine motor skill stuff. I'm like, okay, let's talk about this. So when you're exposing tissue with your right hand for a resident and the resident's holding the bovie with their left hand and they try to come in and bovie, it's a little bit, the angles are different, right? And it's not as easy to approach. And oftentimes the resident switches or the trainee switches to their right hand with the bovie, but bovieing, interestingly, is probably the hardest thing to do with the other hand. Another one, as a med student, I actually had attendings tell me it's too confusing when we switch back and forth. Pick a hand. I was always lefty. My right hand is not as functional. I was sort of trying to develop those skills. I hate that I was kind of told to pick a hand by someone. This one's tough. I mean, like, I'm not 100% left-handed, nor are most left-handed people. We've kind of figured out which things to do left-handed and right-handed through our entire life. Here we are doing something that we've never technically done before. And we need to kind of figure it out, which is better, right hand, left hand. So deciding to choose on the spot what you should try to do, that pressure is hard to digest sometimes in a more critical setting like surgery. So some discouraging right-handed pressures and left-handed stigmatization. What they told me was, your training will be much better if you can do it right-handed because the people who are teaching you are all right-handed. They will be able to teach you better if you can also operate right-handed, and they'll feel more comfortable letting you do more. I think that was the signal I needed to hear to just completely switch to being right-handed in the operating room. I can't argue against this. I am not saying that all lefties should operate left-handed. I They have to make this decision themselves. But there's some truth to this. It is easy for me as a left-handed surgeon to teach right-handed trainees because I see right-handed trainees more than I see left-handed trainees. I am left-handed, so maybe I know how to like navigate that. But there is some truth to this, unless we as surgical educators are kind of more willing to help the left-handed person through with this. Just so if another quote, I do remember being embarrassed as a medical student when I would like go to cut stitches with scissors in my left hand and it wouldn't cut. People would kind of like grunt or roll their eyes or whatever. And then I would want to be like, sorry, I'm a lefty. Like I'll switch to my right hand. When I was a medical student, you don't know how many times I let the scrub tech hand scissors off the field because they said the scissors were faulty, just to not call out that I was left-handed, right? Because no one appreciated that I was left-handed. Scissors weren't working. Surgeon gets frustrated. I let them hand them off. Let's get another pair of scissors. So there's a lot of scissors out there that went for repair that were not broken. Okay. So educational wishes of left-handed medical students. Maybe you have someone who already kind of feels out of their element in the OR. They're a little bit uncomfortable, but maybe they like surgery. You just start piling up all of these negative effects, and then it just sort of deters them from surgery. If you just make them feel a little bit more comfortable in the OR, they're more likely to enjoy their experience. Maybe they would go into surgery. And I think this is kind of the what we pulled from that initial survey of medical students, that if enough of this occurs, it could deter somebody from going into surgical field. I wish someone had asked me before we got into the OR, like, are you right or left-handed? I think just knowing that there are left-handed instrument sets, so like learning right away that there were other tools that were specific to left-handed people, I think it would have been nice to know. Very simple question, just ask kind of before you get started, right-handed or left-handed. If you ask that question, you identify someone who's left-handed before they even start, so it's not a surprise of you're left-handed. I think it would be very comforting for that person. So like, how does this make you all feel? I mean, this pulls out a lot of emotions. You guys have been operating for decades, right? You guys have been operating for just a little bit, but maybe have helped train medical students who are left-handed and things like that. But it tends to bring out very kind of dichotomous opinions from people. And this was interesting because when we submitted these to the different journals, we weren't sure what kind of response we were going to get. We submitted these to surgical education journals, thinking that these people will be open-minded, and reviewer one for this first study, very first comment. As a surgeon, I find the base assumption of this paper critically flawed. The authors start from the implicit assumption that it is the responsibility of the surgical field to accommodate their left-handed status and any emotional state that may result from it. I mean, how do you even respond to that comment? And yes, I know, exactly. And ended up getting accepted in this journal without any reviews, which was funny. But so I mean, like, this is like inherently the problem. I mean, like, isn't it our responsibility as surgical educators to help people through this process, right? Like, independent of if someone's really tall, you have help coach them through like asking the other person to use a step and raising the table and making sure you're ergonomically appropriate. So, I mean, emotional state, I don't even know what's going on that one, but I don't know, it was funny. However, like, it flips the exact other side for reviewer two, as reviewer two always kind of is a little bit different, but handedness should never affect career choices. And obviously we attending surgeons have done a dismal job in this regard. So again, a very positive response to this. And like, that's what this issue tends to draw out. Okay, so the surgical training experiences from the residents, and I think you'll see the differences here in kind of in looking at this from a different angle than just choosing, should I be right or left-handed? It might be actually deeper questions to be asked. And some of those themes include comfort and safety, right-handed learning environment, left-handed and the left-handed training paradox. My dexterity was so strong, left-handed for like anything, that's very fine movements, that if I tried operating with my right hand, it just felt uncomfortable and not natural at all. I don't think any patient would want somebody to do something that felt not comfortable and not natural, right? And I think that that's something you have to like take into consideration, and just letting the trainee kind of figure out what is most comfortable and natural for them, and try not to put your opinion on them too much. The attending took great offense to the fact that I was operating on his patient with my non-dominant hand. He was of the impression that I was pretty much negligent and unsafe and putting his patient at higher risk. If I had not had that experience, I definitely would not be as determined to be a left-handed surgeon, because it's kind of true. Most people are learning with their dominant hand, and patients deserve their best, and my best is not my right hand when it comes to suturing. To create a study that would allow you to compare right-handed versus left-handed surgeons and outcomes of procedures would be incredibly difficult. It'd be powered like through the roof, right? But I think like that's ultimately what it comes down to is like what's going to be the best patient care, best patient outcomes. And, you know, this is tough. You're using instruments that were designed for a right-handed person in your left hand. Is that safe? You're asked to use your non-dominant hand to do fine dissection. Is that safe? So you kind of have to look inside yourself as a left-handed person to kind of decide which tasks are okay for you to do right-handed versus left-handed. For the right-handed learning environment, it's every single day you use things that are designed for right-handed people and are designed in a much stronger, I mean more strongly than you know, normal paper scissors or whatever other everyday things you encounter that are made for right-handed people. Most surgical instruments like, you know, needle drivers, hemostats, scissors are very explicitly designed for right-handed people in such a way that you actually have to use them incorrectly if you're left-handed. This is kind of what Julian was saying. Every single ratcheted instrument is right-handed. To kind of open those and close those is tough. But you figure it out and et cetera. But obviously you have to accommodate for that. I feel like I've gone to great lengths to almost hide that I'm left-handed because I don't want to be seen as somebody who might not be as good technically in the operating room, which is not the case at all. But I think that stigma still exists. So I'm a huge sports fan, as a lot of you guys already know. But you know, I think when you watch a lot of baseball, I think it's very accepting about baseball, right? You see a left-handed pitcher, it's not a surprise, right? There's still one sport that I watch too much of probably, but I think the left-handed quarterback. I think whenever you see a left-handed quarterback, it still looks a little bit different, right? So when we saw this beautiful play from last week, you know, again, this isn't the perfect one to see throwing technique and stuff like that, but when you see Michael Penix throw with his left hand, it just looks different. And I'm sure a lot of you, when you're watching, I picked a certain play for a certain reason, but you know, if you look at it from the other direction, right? If you mirror it, right, it actually looks more normal, right? And not that the left hand looks weird, but like it's still awesome. Yes, exactly. So my point here is that, you know, it looks weird. It looks different. I mean, you may remember the first time that somebody wrote with their left hand in front of you, or they sewed with their left hand in front of you. You had to like process that in your head. And like when you watch a left-handed quarterback for the first series, you have to process that, oh, this is going to look different. Is their technique off? No, actually their technique is just fine. It just looks different. So I think the same thing occurs for left-handed people, that they feel like they are doing something wrong because they're doing a left-handed, but honestly, they're probably not doing it wrong at all. If anything, they've thought about their technique more than a right-handed person because of that assumption that it will look wrong. So the left-hand training paradox. So we all need to be two-handed surgeons. This is a 100% agreed upon thing. Your dominant hand needs to do what your dominant hand isn't doing. For a right-handed person, that means their left hand needs to assist them. For a left-handed person, it means that you need to be able to do the procedure left-handed or right-handed. There's some truth to that. Ambidexterity, we'll talk about in a second. And then lastly here for these quotes, I think this is a pretty strong one. So it's tough to know the right answer. It's like, yeah, what do you weigh? Like the learning benefits to be a left-handed trainee or the comfort of the right-handed surgeon who's the attending, who's primarily responsible? That's a tough thing as a trainee and as an educator. Like, where do you kind of push the line to help educate versus making sure the outcomes of the patient are ideal? So very simple suggestions for all of us surgical educators. You should be aware that a sizable amount of their learners are left-handed and they face unique challenges. Period. Just to be aware of that, as I've just done for that you all right now. And then second, don't dictate how they should use their hands. I had mentioned it's not dichotomous, all left, all right. It's important that you realize that some of the activities they're going to do in the operating room are going to be left-handed and some of them are going to be right-handed. I mean, when I'm assisting a right-handed resident in opening an incision, I'm doing it entirely with my right hand, right? Because I have to allow them to use their right hand to kind of do the parts of the procedure. So you have to be able to be flexible with that because that rubs some people the wrong way. So what have we done and what are we doing? We've bought a whole bunch of left-handed instruments that we hand out to left-handed medical students and trainees to let them borrow and practice with and see if that's something that will help them, will make them feel more comfortable operating with their left hand. We've had dinners where we had left-handed faculty at the university and also left-handed medical students and trainees. We just talked about being left-handed. Dana Feldman has been working on some of the more current active stuff with Dr. Okalami. We kind of got plugged in with him about kind of talking with the medical students about like a policy. Should there be a policy in place for left-handed medical students and residents? Should there be more instruments in the operating room? Should you create a formal mentorship or decision process kind of help them through this decision process of being left-handed. We attend suture sessions, or we try to. Thank for the residents that have been able to attend them for me, since I haven't been able to this past time. And but also making a left-handed handbook. And this sounds like it's a pretty simple idea. Just like ask specialists from every single specialty what aspects of their field are handed, and would they wish they would have known about prior to embarking on a residency or a training program. Putting central lines in, you know, intubating, you know, robotic surgery, as I mentioned before, which hand do you put the instrument in, scissors, needle holder, thing like that. So what can you do? So I think, you know, Tim said this beautifully at one of the surgical education conferences that we did in the past, but you know, when the medical student or the resident comes in, you remember, like, they've been thinking so much about like indications for the PCNL or the cystectomy or the pyeloplasty, and they've been reading about the patient and all that other stuff. And one aspect that they're most nervous about is like the technical skills and how they're gonna do in the operating room, and how the person across them is gonna receive this left-handed person, and how they're gonna help coach them through this. Is this gonna be a positive experience? So just like ask them, you know, about their handedness, try to normalize it for them. Don't force them to be right or left-handed, and kind of let them kind of navigate this decision, this technical decision on their own. They've done it for every other technical skill in their entire life. They just need the support of the people around them to do that. So this is probably the best comment that I saw. And you know, this came up a lot, and this came up a lot in the qualitative surveys about this dexterity thing. And a lot of left-handed people said that, like, in the end, they felt that they were more comfortable with both hands as a left-handed person than somebody who's right-handed, because they're forced to use their right hand as they have been their entire life, and also in the operating room. So, I mean, being a two-handed surgeon is an incredibly important skill to attain as a surgeon. And this quote here kind of emphasized that with the ambidextrous infusion, that I would suggest that right-handed people need more than left-handed people. So I want to thank you for the time, and thank Julian. Here's the two of us hanging out last week, and I'm happy to take any questions or comments. Got something from Dr. Way. Are there neurologic evidence for any CNS benefits from making right-handed person to perform tasks with the left hand? I don't know about the CNS benefits, but I mean, like, the muscle memory of using your other hand. I mean, it's very, very true. So I mean, like, you know, JJ McCarthy brushed his teeth with his left hand for many months leading into the championship game. Whether or not that helped him use both hands and things like that, but there's a lot of people out there that force themselves to use both hands. I mean, Larry Bird won a whole game using his left hand and scored like 50 points just to make a point. So I think that if you're able to train your left hand or your non-dominant hand, it'll make you a better technically at anything.
Mentioned that he started trying to shave with his left hand, brush his teeth with his left hand, do other things on a daily routine basis that he was able to judge and evaluate, and we try to build that side up, because right now it's laparoscopy. Interestingly, their tools are truly ambidextrous around the handle setup, but people want to help like that. So it's certainly a job.
I have to say, when I got a comment as a resident, what's up? I realized how much it's complicated to operate with these things. But I got like comments about my right hand or my very left-handed, and I was told to brush my teeth with my left hand. And maybe like I was a resident, I was really tired, and I was right, and I just like couldn't do it. I cannot do that. I sometimes I try to I but my husband, however, who's righty, brushes his teeth with his left hand, eats with his left hand, plays football, and like other sports with his left hand, like with his body. I think it depends on the person.
100%. Yeah, I'm pretty mixed. I mean, there's some people that are very lefty. I'm pretty mixed lefty.
Those who are interested in education, it's a low-hanging fruit.
Yeah. Dr. Krauser had asked about surgical simulation. I mean, to help surgical educators, yeah, I think 100%. Yeah, I think a lot of this comes down to time. And how often does a left-handed, resident come across? It's only 10%, and you only have, a dozen plus residents. So it's like when you're only going to see one of these every year or two, so it's something you have to be very motivated to want to kind of help do. And I think the short answer is yes. I think unfortunately, a lot of this still falls onto the trainee and the medical student because it's gonna take a big wave of energy for all surgical educators to get on board with this. Just helping the trainees kind of draw attention to their left-handedness in a comfortable way, and oftentimes teaching the surgeon themselves how they need to help them as a left-handed person is probably going to be the best approach because they're the ones that are most vested in improving their own technique.
Hey, Bryan,
Yeah,
this is Uni. Can you guys hear me?
yeah, good.
Sorry, is there someone else talking?
No, there's not. It just, you like came from the ceiling and it was
Ethereal?
godly, yes.
Anyways, so I wanted to thank you guys both for presenting on this. I think this is amazing. And I think you guys are absolutely right in the sense that, or absolutely correct, not right, in the sense that, a lot of it is awareness because, I have worked with obviously lots of left-handed surgeons as a trainee from training here, but also some trainees here. I don't think I was aware at how self-conscious people can be about it. Which it was surprising for me just like listening to those comments because I'm never trying to make people feel self-conscious about it. And I never dictated what hands they use. And actually, honestly, I'm not like even thinking about it. But it's just that how much it can affect them. I think that's a huge deal. And if we just even know that, then I think that helps bring patients to the whole OR.
100%. Couldn't agree with you more. Just make them feel comfortable. The whole OR, the surgical techs rolling their eyes, but having to reload the suture and stuff like that. I mean, I still get that. I've been working with these people for years.
Yeah, and I think from my standpoint, I'm like I said, I'm really I'm not trying to make them feel self-conscious about it. So now I'm a lot more aware, and I don't think realistically, I think I'm gonna ask every med student that walks in like, what handedness are you? I don't know how real that could be just from like knowing myself, but at least being aware that that could be a possibility. And being able to take that into consideration and have them kind of lead because like you're saying, you kind of know what you do right-handed and what works for you left-handed. And so I may not be able to teach it, but they may be able to find ways to work around it if I give them a room to.
100%. Some people have suggested that like when medical students write their glove size on the board and their name, that they maybe include left or right-handed. Again, it's a big ask because 90+% of the people are not left-handed. So how do you, accommodate just the left-handed people? Thanks, Uni.
Yeah, as you said, this is very insightful, I think, a lot to think about. It's the operations that we do. So a question for you, can you comment on the differences in the experience doing open operation versus robotics, right? Like when I operate with scissors in my right hand and my sector is left hand, so how does that happen?
Yeah, I mean, I think, if someone handed me a needle driver with a needle loaded in the right hand, I would just simply switch it to my left hand, switch the needle around and do whatever I needed to do, right? Robotically, it's a very explicit ask to ask them to switch the instruments at the bedside. So like I operate right-handed as a robotic surgeon, right? Because in my training, like I didn't want to switch instruments. It was kind of a big deal. I'm only getting on the road for a few minutes and whatever. I just didn't feel comfortable saying like, hey, can I switch the hands? And I don't know if that how it is for other left-handed people, but I mean, how often have you as robotic surgeons been asked to switch the hands as you're doing the case if it's a left-handed trainee? I mean, did Chris Tam ask you to switch? Has Hanan asked you to switch? You know what I'm saying? Like probably not. Go ahead, Courtney.
A robotic surgeon, if you would have me switch And, as we did it, we realized that there's benefits to ambidextrous experience with robotic surgery, like making an angle, and so he started to like get the for robotic experience with ambidextrous, so like, there's advantages switching ambidextrous, depending on what side of the kidney you're on, whatever. So, I thought it was beneficial. But it's easy, a lot easier to get.
But then like bedside, the side of the bed that you're on, do certain parts of the procedure, that is incredibly difficult. You have to be very conscious with open surgery. Because like what's easy for your, going into the pelvis, like if you're standing on the right side of the patient and you're left-handed, that's nicer, right? But if you're on the right side of the patient and you're left-handed and you want to use your left hand, you're like, it's a much more difficult maneuver. So you just gotta like ask those questions, switch sides of the table a lot. And what's easy for you, oftentimes it's easy for you on your side of the table, if you're going like down or up with your hand, it probably is easy for the left-handed person across from you. So if it's easy for you and you're going up or down, then it's probably easy for them as well. But and then also when you're at the perineum and doing any kind of lithotomy, if the left-handed person sits on the right side and the right-handed person sits on the right side, it's kind of nice. You both have your dominant hand in there, right? So there's a little bit of advantage for that as well. So, you just have to think about each position, each surgery, just ask the question, like, what do you think would be easier for you here? And then 30 seconds later, you come up with the choice. And if it's wrong, then say, okay, let's switch back. Just ask the question.
Because you guys are mostly right-handed, like when I do the innership pass, I do it with my left hand because I'm always on the wrong bad side, because you guys look the good side. And then now I can't do it with my right side very well.
And that's what a lot of good surgical educators have done. They have already gone to the more difficult side to accommodate the right-handed person, okay? Which is great, which is what you want. You want to make it easier for the trainee to use their dominant hand in the more ergonomical approach. However, but the left-handed person, you get to be on the easy side again. Yeah. Oh, not anymore. And also too, I think urology is like, is really good in the fact that we work in a very symmetric organ system. So we're used to kind of having to flip between right and left side. I think it's a little bit more of a struggle, especially like in hepatobiliary, right? It's very one-sided. There's no contralateral side, right? So that's equal in anatomy. So their setup is very specific to handedness, which I think makes it difficult for some of those surgeries. Okay, thanks everybody.
We probably got robotics, so I just.